What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. Today's video will be covering what I do as an X-ray tech in the emergency room department. So to give you context / credentials for those who do not know, I'm an X-ray tech. I've been pushing the radiation into people for 4 years. I do night shift, 7 on, 7 off schedule. I work a lot of overtime. So I do dabble in day shift. So as far as X-ray goes, let's say you're new to the field and you just have basic Timmy knowledge, as I would like to call it, everyday people. So essentially what we do is someone comes to the emergency room, says, my chest hurt, I can't breathe, something's wrong with you. The doctors use us, the technologist. Now, technician is someone who works on our machine and fixes it. Technologist is the one who uses said X-ray machines to take pictures, diagnostic images. And we follow by several ethical codes as low as reasonable possible. So we try to use the least amount of radiation to get the most optimal images, aka trying to the risk for the reward, the benefit outweighs the cause of several things such as cancer and other, depending if you're childbearing age and other, stuff that comes with radiation. Same thing, keeping us safe and keeping the patient safe. So as far as day to day, I would say you clock in to the hospital. You commute with the other techs and be like, hey, is everything working? Is there something that has to be done? And they're like, okay, we have this, this, and this. You're like, okay, they leave. And usually at night, there's less staffing, less everything. So we have a little game plan as far as, okay, we kind of do it in rounds. It kind of makes it easier depending if there's trauma or not. We'll go, shoot some, come back, put them online. And the doctor will look at it, and if he needs further images, he will either put the order or call us. So the main two doctors you interact with as an X-ray tech, you have the radiologist, who is the head dog of radiologists. He is your doctor. Well, the doctor who reads the actual images. And he's not your supervisor, but he's just the doctor who just critiques the images and will consult with the ER doctors or whoever is requesting these images and provide further help to get the patient. At night shift, we really don't interact with those people, with those doctors. It's more of online rads where I work at, but some places do. Especially in day shift, you will interact with rads. And yeah, usually majority of our job, I would say 80% of our job is chest x-rays, which are pretty easy. Well, especially if it's one view, sometimes it's two view. 30 seconds in and out. One view, 1 minute. If they're walkie-talkie, that's probably the fastest in and out you can do. Overall, the job is pretty simple. Occasionally, you'll get some traumas and you get more difficult patients. As far as the medical field of spectrum of stress, I would say we were at semi towards the bottom. I would say nursing would be above us. They're more stressful. As far as overall work stress goes, it's very physically demanding occasionally because if you got to do morning ports and if you have to lift patients and move patients, that's kind of where it could be more physically demanding on your body. And, doing portables, walking around. But that's as long as you're semi in shape and you do some level of exercise, it won't be a big deal. So it's good. I would say pay kind of ranges depending on where you live and city and how many credentials you have. As far as radiology goes, you have CT, X-ray, ultrasound, mammogram. There's various amount. But kind of towards the bottom is X-ray. It's kind of the baseline. Most hospitals you go work at, there will always be at least X-ray and CAT scan are kind of the two base, and then ultrasound may have to be called in, and MRI. So and all those other ones are more of a day shift. But at night, for sure, X-ray and CAT scan are the two. So if you live in a smaller city, I would say anyone within the range of 20,000 population or lower, most hospitals or places will have usually an X-ray and CAT scan will be one. Where I work at, our city's bigger. We're like probably 80, 90,000 population. Trauma 3. So we have 2 at night, 2 X-ray techs and 1 CAT scan tech. And I mean, the pay will vary. I've seen techs get paid as little as 17 and 18 in certain states, and it can like go all the way to like, I would say 50 to 60, but that's more of a, you work at California, you're a trauma 1, you're travel tech, you could probably make that higher end. Now, as far as like, you're like, okay, Miguel, I understand that's hourly. How much like would it be in a year? So you would probably range between, on the low end, about like 35, and you could maybe push 100,000. And that's like 100,000. That's probably if you are making like the mid range hourly with overtime. And like without overtime, you'd probably have to cut it in half, so maybe like 50,000, probably without overtime. But I work a lot of overtime. Where I work at is a good amount. The max I've ever had was like 50 hours of just overtime, so that is an option. Usually a month, I at least, I would say 2 to 3 shifts extra. There is on call, especially if you work at a hospital. We average 2 days in call. And as long as your manager's pretty cool and isn't on you all the time, the gig's pretty easy. And as long as like you build a decent relationship with the rads and the ER doctors and the nurses, you can all get along, and it's a pretty good job. I could see with time, depending on your equipment and your nurses, and there's a whole little things that's very situational. It could intertwine to where it could bother you, or you could start complaining about stuff. But the overall gist of X-ray itself, it's a pretty good gig. My lady's a nurse, so every day I get reminded of how it could be worse and how more harder it could be. So I'm thankful I choose the X-ray. And yeah, it's been your boy Miguel. See you on the next one.